Collaboration between hospitals, health systems, and community health professionals are vital in the effort to increase health equity in communities. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Petterly, Senior Writer with AHA. In this podcast, Jay Bhatt, Senior Vice President and Chief Medical Officer of the AHA, and Maurice Jones, CEO of the Local Initiative Support Corporation, to discuss social determinants of health and how hospitals and community development organizations can advance health equity through collaboration.
Hi, everyone. Welcome to Advancing Health in America, AHA's podcast channel. We're here today with Maurice Jones, President and CEO of the Local Initiative Support Corporation. I'm Jay Bhatt, Senior Vice President, Chief Medical Officer at the American Hospital Association. Maurice, great to have you with us today.
Jay, it's great to be with you.
Fantastic. What does the Local Initiative Support Corporation do, and how does its work relate to health?
Absolutely. Well, we are a 40-year-old community development organization working across the country through about 35 local offices and then partners in 2,100 rural counties. So we work in every state in the union. And what we essentially do, I tell people all the time, we're in the opportunity business. Through the use of capital, through the use of technical assistance, through the use of advisory services, we work with partners to get projects done such as affordable housing preservation and new development, such as small business lending and small business growth and entrepreneurship, such as making communities safer and making communities healthier in the sense of catalyzing opportunities for recreation. The connection with health, of course, I tell people all the time, we were working on the social determinants of health before it was cool. We are working on those things that really determine the health of an individual, the health of a community, and ultimately the health of our nation. Do people have quality, affordable housing to live and raise children in so that children aren't, for example, exposed to asthma risk like allergens and lead paint and things like that? Do people have the skills to successfully compete for jobs that pay livable wages and beyond, which will allow them to pay their bills, pay their medical bills, allows them to, if you will, de-stress about issues such as income and wages? Do people have high quality recreation spaces where they can go and get exercise? That's the sort of stuff that we work on developing and sustaining in communities. Those things that outside of the clinical setting really impact the individual's health and the community's health. That's how our work relates, if you will, to the health space. We really consider ourselves part of the country's healthcare journey.
That's great, Maurice. And I think you've really lifted up the opportunity for impacting people's lives where they are. And also this notion that, studies we've seen reveal zip code, even more than genetic code, is a strong predictor of health, well-being, and lifespan. How long you live and how well you live. But for many communities, a small distance can add up to large health disparities. And so I think this notion of that healthcare and community are more effective when we combine our efforts to address health issues together than when we work separately. And so in that space, we created the Hospital Community Cooperative to drive powerful change and improve people's lives. And I think you've alluded to it, and certainly LISC has been in this space of working with hospitals and health systems and community partners, that hospitals and health systems with community are in a unique position to close this health divide of the disparities in life expectancy across place. And so in response, the American Hospital Association and its affiliate, the Institute for Diversity and Health Equity, with generous support from the Aetna Foundation, have launched the Hospital Community Cooperative, a national program dedicated to closing gaps in health equity. And what we've seen in the last year has just been incredible. I think in partnership with LISC, Health Begins, and our 10 pioneers, large numbers of community partners that have come together, tools and resources that have been developed. And, the Aetna Foundation has been in the space trying to address this issue of improving the health of communities. It's synergized with their work, and we've been really grateful for their support and partnership as well. And Dr. Garth Graham, who leads the Aetna Foundation, has been, from personal experience, very passionate about these issues as well. And I think that's what's also exciting is that Maurice, you, Dr. Manchanda, Dr. Graham, and Rand, our evaluator, along with our partners on the ground, our 10 pioneer hospitals, are doing incredible work. And I think the learnings we're getting from that are really going to help improve the health of communities and give organizations a blueprint for opportunities that help move health and other healthcare systems can adopt. So that being said, hospitals, I think, are engaging in this work because it's a real imperative on the issue related to health outcomes. We spend a lot of money in this country on health, and so the affordability issue, both out-of-pocket costs for consumers, their ability to know that they can not be bankrupt by the healthcare costs that they have, but also have the opportunity for economic mobility and prosperity because their health is better, that they can, together with their families, live their lives and contribute. And so we also want to deliver reliably high-quality care, address the social factors, the social determinants, and issues related to health equity. And, I think value-based care models are supporting this along with Medicare Advantage and others. And I think there's just a great confluence of factors that are motivating and bringing awareness to the importance of this work of addressing the health of people and families and communities. And so we hope that there not only be results that will improve outcomes and lower costs, but we will hope that we will have strengthened hospital-community partnerships, not just for a moment, but for the long term. So, Maurice, what kinds of opportunities are you seeing? What challenges are you seeing hospitals face in pursuing collaborations with community organizations? And how have you seen in this work and other work ways that it's been overcome?
We are so grateful for the aggressiveness, actually, of our hospital partners in forging relationships with us to do this work. And so the sort of things that we're really seeing are, for example, a hospital in Ohio that we're working with that decided, they started with, hey, listen, we are seeing a large percentage of children from a particular neighborhood presenting in our emergency room with asthma, and we are treating them, but we know that the underlying cause is actually what's going on in that home. Can you help us with this? And this hospital stepped up, and we, together with them and a bank, forged a grant partnership that was giving homeowners in a particular neighborhood small grants so they could upgrade their housing to remove things like lead in paint and allergens, mold, and other things that were contributing to the asthma that they were seeing in the children. And this hospital just stepped right up and contributed to that pot with aggressiveness, and we're getting to work there. We're seeing other hospitals who are tackling, for example, the quality housing and the supply and the preservation. And so in several places around the country, in the Bay Area, in the D.C. area, in Charlotte, North Carolina, in Hampton Roads, Virginia, in Boston, Massachusetts, we've got hospitals who are contributing both money, they're contributing, and that's debt money, by the way, and grant money. They're contributing their talent, their data. They are working in partnership on governance structures, and they're trying to get at this issue of producing more quality housing or preserving housing that's affordable in the communities that they care about. or helping to repair housing. We've got another hospital system that is particularly interested, for example, in attacking this issue of disparities in wealth, in particular between communities of color and white communities in the wealth space. And so they are investing in a fund to launch entrepreneurs of color and women entrepreneurs. So we are seeing hospitals really attack a multiplicity of issues or challenges that are contributing to these disparities in health outcomes and these disparities in life expectancies. The sort of things that they're having to really overcome, if you will, to participate in this are making sure that they understand what their best role is with respect to these partnerships. And their roles are usually varied, or I should say numerous. One is certainly on the investment front, but two is they have incredible data regarding population in their service areas that can help us be targeted about where we go and actually what problems we try to serve. Three, they want to make sure that they understand and appreciate the public's perception of them, the community's perception of them, and how they forge closer bonds with the community so that the community is also at the table helping to make decisions. Those are some of the kinds of things that hospitals are doing or are approaching or dealing with as they pursue these partnerships in the community. But make no mistake about it, with a leader who's committed to this work, the hospitals have been able to overcome any challenges and really are leaning into this work with us. And it is the fastest growing set of partnerships that we have as a community development organization. And we're truly grateful for the work that your organization is doing and truly grateful for the hospitals that are stepping up and attempting to be bold and do something substantial in this area.
Thank you, Maurice. That was inspiring, I think, to share some of the stories from the field about how this work is happening. And I think, you said it, this is a new opportunity. There's learning happening in the process. We're seeing hospitals and health systems provide leadership in bold ways, but also be a guest at the community's table, as you alluded to as well. And I think that we're seeing this with the examples in the hospital community cooperative. I think Parkland and Dr. Porsa, talks about the notion of addressing social determinants of health and moving upstream to try to postpone the onset of disease and eventually prevent disease in order to be successful. And so their work has been largely looking at finding ways to better connect patients identified as having unmet social needs with community resources. And we've seen this happen with their work in this initiative around breast cancer and connecting people at risk with transportation support, but also community health workers that are helping motivate change. And medical respite programs have gained popularity recently. And so hospitals are involved in initiatives with third-party organizations that operate these programs. But the patients have such a high risk of returning to the emergency department after being discharged because of challenges managing recovery. And so that adds complexity. And so the community partnership is really important. And then University of Vermont, another partner in our hospital community cooperative, has worked to streamline its care coordination to make it more efficient in addressing the needs of patients who lack stable housing. And so this is where community development is such an important partner in saying, well, how do you create and find affordable housing? And we know that those with unstable housing on average have 27 years less life expectancy. And so hospitals are looking at furthering its investments in long-term stable housing and what's the best ecosystem of care coordination, which combines medical, social service, and the continuum of care to help provide housing stability for the complexity of that population. And, we've had over 300 community partnerships developed, government, public health, and hospitals, and other community-based partners come together. And certainly your work and your team's work at LISC has been really important to driving that forward in this initiative and in others. And so we're really excited.